We would like to thank Biogen and Scholar Rock for their generous support of this symposium. So it is my pleasure to introduce our next session presented by Mary Holt-Paolone. Mary Holt-Paolone, MSRN, is the Program Coordinator and Mental Health Specialist for the Neurodegenerative Disease Center and the MDA ALS Center of Hope at Temple University Hospital in Philadelphia. Ms. Holt-Paolone obtained her Bachelor of Nursing degree from Villanova University and received a master's degree in counseling psychology from Chestnut Hill College. Mary has worked within the fields of neuromuscular and neurodegenerative diseases since 2005 and is passionate about caring for patients and families, facilitating support groups, connecting resources, educating communities and fellow healthcare providers, and advocating for improved quality of life among the neurodegenerative population. In addition to her work at Temple Health, Mary serves as the Educational Program Coordinator and Clinic Liaison for the Board of Directors with the ALS Hope Foundation. Ms. Holt-Paolone has focused much of her career on the role and study of stress and mental health as it relates to physical health and chronic medical conditions. She owns a private coaching practice specializing in stress management and mindfulness, and she develops training programs for various companies, school systems, community, and healthcare organizations. Mary, we are so glad to have you here today. Thank you so much for being with us, and we'll now turn the time over to you.
Thank you so much. Really thrilled to be here as well. Thank you so much. I'm just going to share my screen here. Let's see. Okay, can we see that?
Yes, looks great.
Wonderful. Thank you so much. All right. Hello, everyone, everybody that's here. Thanks so much for being here. And certainly thanks to MDA for allowing me to speak on mental health, which is certainly near and dear to my heart. So we are going to talk just a bit about mental health and really just kind of the basics. I'll go through some objectives that we'll talk about. Let me see if I can. Yes, there we go. Good. Okay, good. I love it when technology works well. All right. So thank you for that introduction as well. You know, I really do feel incredibly blessed for the last 18 years, to be able to work with these amazing organizations and to do the work that I get to do every day and work with the families that so inspire me and teach me, just teach me every day a ton about life. So thanks to all of you. All right, so what are our objectives here? We're going to talk just a general overview of what mental health is. The importance of mental health we'll talk about. We're going to identify some barriers to supporting mental health, and we're going to consider mental health as it relates specifically to SMA. We'll talk kind of generally about neuromuscular diseases, but then more specifically to SMA as well. So we're going to talk about signs of impaired mental health and how do we know when somebody might need some intervention or some additional support, and hopefully help everyone determine when to seek help if that is needed, and then how to access resources and what resources might be out there. So I actually, this quote here, health is a state of complete mental, physical, and social well-being, and not merely the absence of disease or illness. Now, I do have to say, this quote, I don't know if I have ever met anyone that has complete physical, mental, and social well-being, but that's actually not why I use this quote. The reason I use it is just because it really talks more about the comprehensive sense of health in general. And in the work that I do, and I think the way that I try to, or have tried to model my work over the years, is this more comprehensive and integrative approach that it really takes all of these to fully support a person. So thanks to the World Health Organization for that. Okay, so what is mental health? I'm sure we're all aware of what our physical health is, and mental health is a counterpart to that. So it certainly includes our emotional and our social, our psychological well-being. It affects how we feel, how we think, and how we behave throughout our days. It helps determine how we handle stress, how we relate to others and to life. And it also affects how we make choices in our lives. There are several, families that I work with, I know even in my own life, that, you know, the reason that we need to approach all of these pieces in order to fully support someone, there can be barriers to care because of mental health issues. There can be barriers to or challenges physically and medically because of mental health issues. So here at our clinic, we really do try to address all of these areas to help support people in the fullest sense. It's also really important at every stage of life, from childhood, adolescence, all throughout adulthood, all life stages. Mental health is so important. So talking about the factors of mental health, and really this is kind of the determinants of mental health. And this isn't exhaustive, but this is to give us a sense of just really creating the framework of, what creates our mental health, what goes into that. So definitely our biology. We all come into this world with, various sets of genes and temperaments, and then, we begin to kind of put on top of that ideas and understandings about the world around us when we, get into our families. So there's definitely biology and genes, brain chemistry, right? How well, from out of the gate when we're born, how our brain is working, and how it's developing. So genetic conditions certainly can affect all of this. And then the second component being life stressors. And that can be everything from, mild stressors of the day to, things like trauma and abuse, medical diagnoses that can really affect our mental health, being diagnosed with a chronic condition, maybe wherever you may be in the continuum, whether you were born, with symptoms of SMA, developing in adulthood, everything from then finances, relationships. So, our life stressors definitely play into this as well. Our family history, our upbringing. What are the, ideas and the kind of understandings around mental health that we were born with, that we grew up with in our home, in our household? Could we talk about, was it okay to talk about things? Or is it okay to talk about our feelings? Is mental health that's something that is addressed or supported, or is it something that's, kind of on the back burner or not okay to talk about? So our family history can definitely play into certain things with regarding our mental health. And then our environment, which certainly we know that, toxins, in the ground, in the air, everything can affect, our physiology and also our brain chemistry. And in the environment too, natural disasters, anything within nature. I mean, all these things can, there's these internal biology, and then there's these external factors that also play into our mental health. And then I put down here thinking, which, our thinking just in general can also, be created by all of these, our biology, our life stressors, our family history, certainly, and the environment, what we learn from society and various beliefs that we take on, not even knowing it possibly. And a lot of times I'll often ask people when I'm kind of first couple times I'm meeting them, are you typically a glass half full or a glass half empty person? And is that, those kind of two various ways of approaching life. And in that, even if we are a glass, it's, those things are helpful for us to know, to kind of anticipate how we might approach things going forward. And I always encourage or invite people to understand that even if you are typically a glass half empty person, that our ways and patterns of thinking can always change. That is definitely one area where we have control. So moving on now to, why is it important to care for our mental health? And, I have to say that as, I don't even know what the word, but extraordinary in so many ways and levels that the pandemic was, and still, the aftermath, and as we're still living with COVID, during that time, as a mental health professional, I really am grateful in a lot of ways that the spotlight on mental health became even brighter. And there's so much conversation and encouragement and push to integrate mental health questionnaires, mental health practitioners within primary care practices. Here we've always taken it for granted in a way, because we, in our multidisciplinary center here for neuromuscular at the MDA clinic that we have here at Temple in Philadelphia, mental health has been a part of it, and our directors feel very strongly that's important. And I realize that that's not the case when I go to conferences, that there's a lot of other centers that actually don't have that. So we're very fortunate. And, so I'm actually grateful that the spotlight has come more on mental health. And I really appreciate MDA for having this as part of your symposium these 2 days. So why is it important? Well, from my standpoint, and of course, I'm probably a little biased because I am a mental health professional and I see the importance of it, or have been shown the importance of it in my own life, that it really can be the springboard for success in every other area in our life, or health, right? Good health in every other area of our life. So it definitely enables effective coping. It prevents mental health crisis. Why care for our mental health? So we can prevent a crisis potentially, we hope. It improves physical well-being. There's a ton of research around the combination and the effects and the correlation between our mental health, our stress, our coping, and our physical health and well-being, and our physical symptoms, especially those with chronic conditions, which has, of course, been my specialty for years. So, it offers us the ability to enhance our relationships with ourself, of course, with life in general, all those external experiences, and also with others. And at a basic bottom line, as a human being, it can certainly help to increase our happiness and overall sense of peace, regardless of what we're dealing with. Those living with, whether there's people here that are living with SMA, or parents of children that have SMA, or caregivers or loved ones, just that out of the gate is an extraordinary stressor, and really significant. So even more so important to address mental health issues and care for the mental health, so there can be, balance of hopefully, more a sense of peace and joy and things like that in the midst of the challenges. So as I had mentioned, so there's a lot of research studies that show that decreased mental health certainly can worsen symptoms of any medical conditions. So let's talk a little bit about, what are some of the barriers to caring for mental health? Why is it oftentimes on the back burner, or maybe not even discussed or thought about? And certainly, even in my short amount of time, you think 18 years, but really that's a short amount of time. So in the grand scheme of things, but I have to say that even myself, I have seen a shift where, it's just not even something that would necessarily come to mind, and still a lot of times doesn't come to mind for people unless I'm in the room with them or on the phone with them talking and asking specifically about it. And especially with things like neuromuscular diseases and SMA, that there can be, not that there's always, but there can be a lot of, physical needs that maybe take the foreground and are precedent. So some of the barriers are definitely just lack of education and awareness. And that's certainly something that is important. And again, why I congratulate MDA here for just bringing education and awareness to the community in this way. So we really hope to do that. If people don't know, then we can't go anywhere from there. So awareness is really the first step. And I hope certainly that this conversation increases or helps to improve people's awareness. And then lack of access to resources, which I see and we see all the time. So that's really an important piece, that, if somebody does have an issue, that, we can help them gain access. And we're going to talk a little bit about that. And then, lack of willingness. And I don't mention this one in any fault finding. I had been and often still am at times not so willing to deal with my mental health just because, other things are taking priority or it just seems like there's so much to do. So yeah, a lack of willingness. I mean, so awareness is number one, willingness is number two, typically, that has been my experience and that I kind of talk with my people, my families about, are we willing to begin to look at some of these issues or potentially make some changes as small as they can be that maybe can have some significant shifts. So, and there's all sorts of reasons why people might not be willing, and I've mentioned some of them, but also too, the stigmas, the stigmas that have been around for years and years, and that's what I was talking about the continuum, and the kind of the cultural shift too, that the stigma that still exists for mental health, that, God forbid we say that we're having a tough time or we're feeling a little self-conscious or, we're nervous about something. They, that shows a space of vulnerability, which can be uncomfortable for us as a society sometimes to deal with. So the societal stigmas around it, and I really congratulate, all of the, the sports and the celebrities, the athletes and the celebrities that are, have been coming forth over the last number of years, talking about their own experiences with mental health. There can be a lot of cultural norms, and traditions that are really ingrained and also to be respected. So, one of the things that's really important is not that there's nothing wrong to say, that anybody's at fault or this is right and this is wrong. It's not about that. It's really about what works best. So is it working? And are there ways that we can work within the traditions, work within the beliefs or the areas of safety and still address the needs in a kind and supportive way? So some of the stigmas, and, there may be people that are listening that, even are aware within themselves that, that they might think that to talk about mental health or address mental health or, mood or emotions or something, it's kind of can be seen as a weakness. There can be some shame around it because it does require the human to be somewhat vulnerable and open up a bit about places that we might not, generally talk about. And then there can also be, and some of my work has been around this piece of this idea of betrayal, that if I share these, inner parts of myself, or, maybe of another, then am I betraying, say, these, maybe my cultural norms or my family traditions or my parents or, my loved one or even myself in some way. So, what our work is to really be, helpful in identifying what some of the challenges or the obstacles are, and then finding creative and non-threatening ways to move beyond those. And then certainly, as I mentioned already, that physical issues can certainly take a primary focus. I know in my own life, I mean, that, I don't have time right now to sit down and journal because I have, 8 other things that are in the fire right now that have to happen. So it does take commitment, and there are small things that we'll talk about. So yes, and certainly it can be easier, right? It can be easier to focus on physical needs versus emotional, mental needs because, granted, sometimes if we start to address some of the emotional pieces, they might not feel so comfortable. And, distraction is a wonderful tool, and getting kind of wrapped up in the physical needs. And I'm not saying in a negative way, but focusing more on physical things, it's like you can clean your bathroom, you can see that that's finished. Oh, I can check that off my list. The emotional pieces, oftentimes for people in the mental health, can be a little more nebulous and esoteric and not as concrete and tactile. So yes, we try to work within the barriers and be able to, find creative ways, like I said, to move around it. So just to identify, some general mental health concerns just around, general neuromuscular diseases. Really neat survey was done back in 2018, and this was over 2,000. Remember, it was over 2,000 people living with neuromuscular diseases. And they reported that 75, and this was actually not just, it was also caregivers and parents, loved ones. 75% of them said that there are psychological symptoms, that they do experience psychological symptoms. People with neuromuscular diseases also report that mental health management is a medium to high unmet need in care. So what that says to us as the clinical people, that this is a gap. This is a gap that is a real need for our patients and families. And we need to find ways to be able to meet that need, because it's a big gap. Mental health issues, among those living with neuromuscular diseases are certainly, increasingly being recognized. I've been doing talks on this for a number of years, but there wasn't a ton of research or literature around mental health and psychological effects of and conditions in neuromuscular diseases. But now there's quite a body of research, which is exciting, really exciting. So specific mental health considerations for SMA. Those living, and again, let me just put a disclaimer out here that this is not exhaustive, and those that are living with the disease, whether it's a loved one or a person actually living with it, you all know more so, and could probably add to this on and on. So there's, when in our realm, we kind of think of it in four particular areas. So the medical and physical. So we think about what are all these things, what are all the potential areas that could affect somebody in their mental health. So medical and physical. Now, certainly, the variation of symptoms and presentations of SMA, depending on the type, can vary greatly. So we have to take that into consideration when we're talking about mental health. And because if there's somebody that's with SMA 1, type 1, it's going to be very different than somebody with SMA type 4. They're going to have potentially a whole different subset of mental health considerations, emotions that go along with it, life considerations, things like that. There's a real valid fundamental experience with this ongoing chronicity of anyone living with a chronic condition. So the ongoing chronicity of the condition, and it's really amazing too, because some people I will talk with, and I've really had the blessed opportunity to actually work more closely with our SMA folks here at Temple over the last number of months, because we have various treatment programs happening, things like that. So that's been really we have now like a focused cohort of those living with spinal muscular atrophy, which has been really lovely for me to see them even more cohesively. And looking at, the various needs for symptom management, the care needs along the continuum, and also the caregiving, whether it's the siblings or spouses or parents or whatnot. There's all sorts of medical and physical variations that come into play. And, a ton of psychosocial needs and considerations as well. Dependency, the person with the SMA feeling dependent, the caregivers and loved ones also feeling that sense of, there can be quite a sense of dependency on their end as well. Socialization, or that they feel responsible for, socializing people and how to kind of keep those connections going. Finances, access to care, access to work, modifications at work, schooling, and all the various coordinating that has to go into all of these pieces. Quality of life, QOL's quality of life. And, quality of life could probably be the umbrella that goes over all of this. And one big area that I work with people too is life planning and a sense of purpose, because certainly what we find is those that I guess a quick way that I describe this to people is, the opposite of depression is actually not happiness. The opposite of depression is purpose and meaning, and that people feel like there's still a will to go on, and that it's not just hopeless. So in our work with folks, what we try to do is really, or what I try to do is help them find, in the midst of all the changes and the experiences that they're having, what are the sense of what's the sense of purpose, what's the sense of meaning that changes dramatically and shifts throughout the course of their life as well. Then cognition, is a piece. This is kind of, and these aren't in any particular order. This kind of medical, physical, psychosocial, cognition, and psychological. But cognition isn't so, it's actually really prevalent in a lot of other neuromuscular diseases, but it can be in several of the types. That there can be cognitive changes which can impact dramatically, can impact care. It can impact just life socialization and moving forward and all sorts of things. So there's also the big psychological factors, emotions, all the emotions, the grief, the loss, the confusion, fear, anger, that can just be a roller coaster. And these are things too. I mean, SMA is certainly a condition that it's not static, doesn't necessarily stay the same, right? So we as clinicians, have to be prepared for people to continually be navigating through this process of grief, loss, confusion, fear, anger, acceptance. Now I'm settling into the new norm. Okay, now I'm settling into the new norm. Oh, now there's another change. So whether it be a physical change or an environment change or something like that. So it is a continual process. And actually, that's just the reality of all of life. But we really, it's pretty paramount in our folks. And then, coping, adjustment to the condition and changes, self-image, huge. We have to address that with people. And you know what? I actually am realizing I didn't actually put on here, intimacy, right? Like physical intimacy with people, with others, with self. So all of those are really important to address, and can affect all of these psychological and our mental health in general. Motivation, feeling motivated to move forward in life, and how that can get affected by all of these experiences as well, and factors. And then again, our thinking and mood disorders and whatnot. So there's a lot, and it's also doable, that we can, with multidisciplinary care, and the support of organizations like the MDA, that we are able to really hold people in a container and provide spaces that they can address, and we can hopefully address all these needs as they arise. So let's begin to talk about, what are some signs of impaired mental health? So how do we know? So impaired mental health, feeling sad and down, or down much of the time. Okay. So feeling sad and down is just a natural part of life, right? It's like our human condition. So that's why I put in here, much of the time. So if we're noticing that and I'm typically asking people, kind of taking a barometer from, visit to visit, or touch point to touch point, compared to last time, where are we? Are we worse, the same, better? What do we think? So having confused thinking, reduced ability to concentrate, right? Now, a lot of these kind of symptoms can come from a lot of things, so say you don't get a lot of sleep and you're having sleep issues, that's definitely going to affect your ability to concentrate. So we really want to be conscious and aware of putting the whole picture together. Is someone experiencing excessive fears or worries, extreme feelings of guilt, extreme mood changes, mood swings, highs to lows, withdrawal? That's certainly a clear kind of pinpoint. Withdrawal from friends and activities, where things that used to bring joy and enjoyment aren't really bringing so much enjoyment anymore. Apathy, lack of motivation, significant tiredness, low energy, problems sleeping. Then, inability to cope with daily problems or stress. And, some people can even have real kind of detachment from reality, delusions, hallucinations, paranoia, trouble understanding and relating to situations and people. Okay, so that's a little bit further on the continuum. And I hope by that point that we are intervening in some way. Some other signs can be excessive anger, hostility, and violence, problems with alcohol, drug use, people using things to just feel better, to try to numb out, to not, so we definitely see sometimes that if people have this tendency, if stressors are increasing, their use may be increasing as well. Major changes in eating habits. Certainly food can be a soother, or some people that are totally stressed and having emotional issues or situations, some people lose their appetite totally. So sex drive changes, and definitely suicidal thinking. And this is if you are yourself having suicidal thinking, thinking of hurting yourself, someone else, or if you know that somebody has been just kind of mentioning or joking about it even, or talking about that. Now, it's important to understand too, and many people might know this already, but emotional and our mental health stressors can certainly manifest as physical problems. They can manifest as physical problems. It can actually manifest as behavioral problems too. So sometimes behavioral problems can be kind of some of the first signs in children and adolescents, where you might see more acting out, more temper tantrums, maybe withdrawal, dropping grades if it's a school-age child in school, sudden changes in social groups, and then there can be all sorts of physical manifestations: headaches, back pain, pain anywhere, stomach issues. That's a big one. Stomach and GI issues, just any unexplained kind of aches and pains. So these are things that we want to try to be aware of as best we can. So one other thing that I always encourage people to do as well is just, from time to time, and whether you are, and this can be really helpful for ourselves, is to encourage just a mental health check-in, just taking inventory every once in a while. And this is not to find fault or to come through these questions and say, boy, I really stink, or I'm really not doing well. It's not to do it with judgment, but it's really just to say, okay, if I'm a business owner and I have to take stock and inventory to know what I need and what I don't need anymore, then let me just run through some questions. So if we can do it in a sense of, oh, I'm just trying to find out what's working and maybe what's not working. Is there anything I need to add here? Is there anything I need to let go of maybe? Okay. Is it working? Is it not working? So I always encourage people that not right or wrong, not good, bad, but more so, is it working or not working? Is it helpful or maybe not so helpful? Okay. And we can be the judge of that, right? All right. And usually those around us that love us. Okay. So mental health, if we're fortunate enough to have that. So mental health inventory, just checking in with ourselves and asking these questions. How is my overall mood? Right? How would I describe my mood? So on a scale of 0 to 10, 10's like the best mood I could have. How's my mood? Right? How would I rate myself? Sometimes people that have a hard time with numbers, I say, all right, so like, what's the weather? Is it stormy? Is it cloudy? Is it sunny? Is it raining? Right? Whatever works. How would others, right, close to me, rate my mood, describe my mood? Because sometimes I can be a little bit not so clear about how I am behaving. So sometimes I'll even ask those around me, have I seemed like I'm off recently? Do I typically wake up looking forward to the day or dreading the day? Right. So if we're dreading the day, that can give us more cues. If we're typically like consistently dreading the day, that can give us more cues and awareness to really check in on a deeper level, like pay more attention to like, wow, how am I going throughout the day? What are the stressors in my life? Right. Just taking stock, not to overwhelm ourselves, but just really identifying, wow, are there things that are stressing me out? How do I cope with these stressors? Okay. Again, not fault finding. If I'm sitting down, I'm eating a pint of ice cream every night, I'm just taking inventory. Is it helpful? Is it not so helpful? Is it working? Is it not working? Right? We're the decider of that. Do I have excessive negative or worrying thinking? That can be a cue to us as well. Do I think about hurting myself? And certainly, what am I doing, if anything, to take care of my mental health? Am I doing anything to take care of my mental health? Right? It doesn't have to be big, huge, activities or tasks. There's lots of small ways to take care. Just checking in is an absolutely wonderful start, right? Because awareness is number one. All right. So when to seek help? How do I know when it's time, excuse me, that I need to reach out, or that I need to get some help for my loved one, or I need to talk to my loved one about their mental health, their mood, or whatnot? So first and foremost, I, of course, always err on the side, and what I encourage people, and I realize that this is not something that I'm hoping that the continuum will continue to shift in this direction, but for preventative, we've been talking over the last number of years about preventative healthcare, preventative physical healthcare with, heart checks and exercise and things like that. So, wow, what a concept for preventative mental health care. Some preventive mental health care, that's the best care, because that avoids crises if we can. But absolutely, please reach out, or ask someone for some direction. If you don't know, if you are concerned about a loved one, please reach out, and we'll talk about some of the resources. When you yourself, for yourself or someone else that you are living with or know of, when mental health really starts to affect their daily functioning, whether it be emotional, behavioral, or physical symptoms, when they're negatively affecting one's own contentment and relationships, withdrawing, or their just ability to function in daily life, where maybe they're not leaving the house, or they're not letting any visitors come to the house, or they are not engaging in social activities anymore. They're not even getting out of bed, or whatever it may be. Or they're just up worrying all night with anxious thinking, whatever it is. Please reach out. Because most mental illnesses, and I say illnesses, most mental health conditions, they don't get better if untreated or unaddressed. They oftentimes get worse over time and can create much more serious issues, whether it be from the mental health standpoint in terms of suicidality or homicidality, or just even physical conditions. Apologies. So, all right. So types of mental health supports. So there's personal support. There are, like, if you have family or friends or coworkers, that can just be your, support from an emotional standpoint, that listen to you talk, that you feel comfortable sharing with, that help you laugh about things or see, more helpful perspectives, whatever it may be. There's support groups, fellow patients and caregivers that really, community coming together and understanding, the specific perspectives that you may be going through is sometimes just unmatched, that kind of support. Community organizations, there's a ton of them. Support hotlines and call centers, there's spiritual groups and churches, meditation, prayer, exercise, music, nature, all these things. And then there's, the clinicians, therapists, and counselors. So when we think about medical doctors and psychiatrists, there's books and online resources, a ton of apps and everything, classes and seminar speakers. So we are absolutely not at a lack of support for our mental health needs. The question is, for a lot of people, is, do I need it? Who do I go to? And how do I access it? Right? So we want to talk about how to be able to access these things. So networking, and what I mean by networking is just talking, just asking someone, whether you're asking your healthcare team, please use them. If you have a physician or a multidisciplinary team like we have here, there's case managers at insurance companies for a lot of chronic conditions. Sometimes insurances will designate, if requested, a case manager that can actually help navigate through the continuum of that condition. So knowing your insurance benefits, if you do have insurance, what can I get through that? Can I get massage? Can I see a nutritionist? Can I see a counselor or a therapist or a psychiatrist if I need to? And what are what kind of benefits do I have to cover those things? And then also, internet, library, community organizations that I mentioned before, and events. So how to access these things. And what I would say is absolutely, if you don't know, that's why I put these organizations here, certainly the MDA. There's been times that I've done, talks like this in the past. And, if people have questions after seeing this or something, certainly reach out to the MDA, and they know how to get a hold of me. If they can't answer it, please know that I certainly avail myself to be a resource, a mental health resource, if I can help anyone find, connection or resources or things like that. So yes, asking the MDA, reaching out, there's certainly the SMA Foundation, the Cure SMA, and the SMA My Way actually is something that it's a support network, for patients. So that could be quite helpful as well. Just, and these are online, that you can access the SMA My Way online, but so network, just talk to people, just start the conversation. All right. So to leave us here, mental health, it's not a destination, but a process. It's not a destination, it's a process. So it's about how you drive, not where you're going. And I love that because it's about how I'm living. Yes, I'm living, but am I surviving or thriving? Right. And I have a choice in that, and we all do. So my intention is hopefully to allow people and encourage people and actually invite people, not to throw a sledgehammer over them. Nothing is a must have, nothing is a must. It's just to invite people that there are ways to thrive. And it's about how we're moving through this journey. And we want to help you do that in a constructive, helpful way, in an effective way. So that, my friends, is it for me. I hope I stayed on time, but I really want to thank you. And I do hope that this was helpful in some way. I want to thank the MDA for allowing me to talk on such a close to my heart, topic for mental health. And certainly we have a bit of time, I think, for questions. If that's possible, if there are any.
Thank you so much, Mary. As Mary said, we would like to open it up for questions. You can use the chat box at the lower right of your screen. So let me pull up the chat and we'll see if we have any questions. I'm not seeing any come in, but if you don't care, we've got a few minutes, so we'll just kind of wait to see if anything comes in. Wonderful information and resources. So thank you so much for being here. It's very clear that mental health is a passion of yours.
Oh, yes. And so certainly that we are, I think the biggest message is just that, we want to help, and however we can do that in a non-threatening way,
Absolutely.
that there are resources to support people.
Let's see, it looks like we do have a question. What advice might you give to parents who think their child might be experiencing mental health challenges?
That's a really great question. So my suggestion to really anyone, whether it's parent or loved one or anything, is, to ask, well, of course, I don't know the specifics. So if depending on how old your child is, if you can have kind of that conversation, just ask, like, how have you been feeling? Oftentimes, if we come across as, I notice, or I see, or boy, you've been really quiet, or you've been really irritable, or whatever, that can sometimes put somebody on the defensive. So depending on how old your child is, if it's a young child, then you might just, need to make that decision as the caregiver, as the parent, that I did with my own children, when my daughter, when she was young, that, I just got her into play therapy. It seemed to me that there was some behavioral, I couldn't have that conversation. So play therapy was a really great thing. And there are many play therapists that can that modify for children that have all sorts of various conditions. So that is an option. But if the child is able to have the conversation, just asking, how have you been feeling? Do you notice any differences? Just kind of starting the conversation and bringing awareness to the person in a non-threatening way, right? Which is sometimes hard to do because as family members and as loved ones, we are so intertwined. And maybe if they are having some emotional challenges, we might be the brunt of that at times. So it's really being able to come to them in a place of non-judgment, if possible, and a non-threatening way, and just asking the questions. What do you notice? Oh, well, okay, so I noticed, and maybe identifying what maybe you noticed and what do you think about that, right? So seeing if we can in some way, help them with their own awareness. Are you okay with how you've been feeling? Is that okay for you? I know that, just so you know, letting them know it could be better. Like there are resources to help support you if that's something that you would want, so you could feel better. Letting them know that it could be different, right? So not knowing the specifics, though probably some general, if that's helpful.
Very helpful. Thank you. And Marissa asks, sometimes it can be hard to find a therapist you connect with, and we have a couple of comments about trying to find someone to speak with. Do you have any suggestions on how to find a therapist, especially someone with an understanding of SMA?
Yeah, it's a really great question. Wonderful. So thank you actually for asking that. So I didn't know how specific we could get in our time. I always tell people, if you are seeking a therapist, and I want people to do this with me as well, if they're like, number one, if you can see any sense of bio, like say you go to your insurance company and they give you a list of resources. If you have access to the internet, see if you can Google them. Psychology Today is a website that actually has a lot of bios on various therapists and clinicians, psychiatrists, therapists, social workers. So Google them, see what you can find out about them. And then certainly vet them. And you can absolutely, I usually, if I'm kind of looking for a referral for someone, I will call or email and vet them and get a sense, if you can read up on their bios, see what specialties they have, see the experience that they have. Do they work? Because some will say that they work with chronic illnesses. That's a plus. So you're at least somewhere a little bit closer to understanding, right? And the other thing that I have to say, so before I forget, interview. You can ask questions, right? If you know certain things that are important to you, like, do you like someone to give you advice? That's important. If you're someone that doesn't like another person giving you advice necessarily, but prefers someone to really just help you find your own answers, that's important conversation you're allowed to ask those questions. It's absolutely, just because they give you a list of people doesn't mean you just have to take whoever's available. Okay. And sometimes it can take trial and error, unfortunately, to really make that connection. But the other piece that I want to say about just SMA in general, or, finding someone that has some familiarity, it's been my experience, it's difficult to find that. It can happen, certainly. I know I just did a search 2 weeks ago and I actually found someone in somebody's area that actually said in their specialization, chronic neuromuscular conditions. This is an absolute jackpot. That doesn't happen very often. So what I do in lieu of that, and because I'm the mental health clinician and also the nurse at the center, I often will tell several of our families, it doesn't really matter to me if they don't understand the disease itself, the specifics. What does matter to me, are they willing to collaborate with us with your permission? Because I will then collaborate with them, right? So you can ask if they have an understanding of chronic illness and kind of living what it means to live with all that and grief and loss and change. These are all kind of the buzzwords that you want to be looking for. Life planning, aging, things like that. So if they have an understanding of those specialties, and then maybe if they could have a conversation with one of the clinicians, either the nurse or possibly even the physician or the social worker if you're connected to a center, that can be really helpful. So what we do is we help to collaborate, and I bring the pieces to them of the specifics of the illness, and then so that they have an understanding better of that, and then they can, bring their therapeutic pieces as well. So if we approach it from a collaborative standpoint, if that can be done, it's all the better, I find. So that's a lot.
Wonderful. Thank you. Thank you so much. That answer just kind of addressed almost all of the comments that we have in the chat. So
Okay.
we don't have any more questions that have come in. We are so thankful that you were able to be with us today and share this information. It sounds like a lot of people very much needed this. So thank you so much for being here.
Good. All right. Thank you so much, everyone. I wish everybody well. And yes, take good care. Thanks so much. Bye-bye.
Thank you so much.